All right, welcome back, Healthcare Experience Matters listeners. Today I am joined by Carly Newton. We are here with a brand new episode of our show. Carly, please just introduce yourself to our listeners and tell us a little bit about your background in patient care and then what you're up to nowadays.
Sure thing. Thanks, Casey. So, my name is Carly Newton. I'm a registered nurse from Australia. So, I spent about 13 years in Australia providing patient care, primarily in ICU. I was an ICU nurse by trade, but then I did spend some time in medical surgical wards as I was getting my ICU post graduation experience as well. So, I did work in public and private hospitals in Australia. And then about 13 years ago, I moved over to industry. So 13 years ago, I moved to a company called Terumo Blood and Cell Technologies, which is a medical device company. We innovate and build machines that actually help get better outcomes for patients through blood and cell technology. So I started working for Terumo Blood and Cell Technologies as a clinical trainer, and then moved to Singapore for about 4 years and worked as their global regional trainer. And then about 4.5 years ago, I was transferred to Denver, Colorado, where I currently reside. And I work more in a commercial role. And really, my role at the moment is getting better access of our treatments to patients. So that's a little bit about me.
That's excellent. And I asked you on the podcast today to talk a lot about your early career when you were working as a registered nurse in Australia. We've never had a Australian healthcare provider on our podcast before. So automatically I was really curious, what are some of the different patient experiences that you've noticed in Australia that might be different from what's going on in North America, and maybe you can compare and contrast, and maybe the two sides can learn from each other based on our interview today.
Yeah, for sure. Interestingly enough, I was in the US for about 9 days and got acute appendicitis. So I actually ended up being a patient in the US pretty early on. And you know what was really interesting? As I came out of anesthetic, there were a couple of things. My boss at the time, obviously, I'd been in the US for about 8 days, so I didn't really have any friends or family here. So my boss, thankfully, nice of her, came down to the hospital and helped walk me through, when I was in emergency. But what was really surprising was when I woke up in recovery, she was standing at the end of my bed. And I was like, oh, hi, how's it going? And in Australia, there's much more guardrails around when family members can come and visit patients and things like that. And you just would never get a patient, a family member in recovery. It's just a no-go zone. So that was the first thing as I sort of woke up from recovery and was quite nauseous and vomiting, was the fact that, there were just family members in the recovery room. And then when I got back to the ward, the nurse came and did my observations and whatnot and asked me to eat something. And I said, well, when is dinner coming around? And she said, oh no, there's a menu in your drawer. Just order what you want. She said, we've got 24-hour food service here. And that just blew me away, because working in a nurse in Australia, there were 3 scheduled meal times. They were very basic meals. And when I worked on the wards in a surgical ward, if a patient came back at 9, 10 o'clock at night from surgery and they were hungry, we would actually have some ham and cheese sandwiches or cheese and tomato sandwiches if you were a vegetarian. And that was the only thing on offer at 9, 10 o'clock at night. So I guess for me, what really struck me was that this, being in hospital in the US, it was designed to be an experience, right? It's catered for, family and friends feeling like they're in control, and, they can access and get access to you wherever you are in the hospital, because it's, their right and they want to protect you and advocate for you whenever they can. But then the second thing that really struck me was, holy moly, this is a whole experience that these patients expect from being inside a hospital. So they were sort of the two things from very early on being a patient in the US that struck me the most.
That is really, really interesting. So, as a nurse, I know you've got a lot of experience with communication, and in fact, before we hit record here on our podcast, you were telling me that you could talk all day because you're all that experience as a nurse. So,
Yeah.
tell me a little bit about the importance of communication and delivering great patient experiences.
Oh, it's one of the most fundamental things which is going to help a patient, understand what their needs are and understand what they need to do to get better, right? And, I'm a huge, huge advocate of empowering patients through education. Especially when I was an ICU nurse, really spending the time to talk to family members. I mean, it's the most stressful time of their lives when they've got a loved one in intensive care, and to be able to give them what they feel back, some control, because if you don't have control and you don't have the information to make educated decisions, you can just feel like things just spiral out of control, and then there's just a whole heap of things that can happen from that as well. So I think being a nurse, one of the privileges I guess I had was being able to help patients understand about either their disease or what was happening or the procedures that they needed to help get them better. But it's really interesting, after having moved to industry, being on that education side around different therapies, around advocating to get better access of these procedures to patients, I think is just as rewarding, which really surprised me, because I always thought there was a sort of big wall between industry and patient care. And as a nurse, I think being able to still empower patients, educate patients on an industry side is just as fulfilling and important as it is, being that healthcare professional inside the hospital as well.
When it comes to delivering great patient experiences in Australia, is there something that they do really well over there that maybe we're not doing so well over here in the United States that you've noticed?
So I think both healthcare systems have phenomenal technology and phenomenal healthcare professionals that are highly trained, educated, and very compassionate and very empathetic towards patients. I guess where, and I think we touched on this before, where it's different in Australia is that patients come into hospital and they don't expect the whole experience, I guess. They don't expect this whole journey within a hospital to be pleasant the whole way through. So I really think it's about, and that's so hard then on a physician or a nurse to manage those expectations, right? I mean, absolutely, as a patient, you absolutely deserve access to safe care. You need to be treated with dignity and, be trained by well care professionals. I guess, where it's different in the US is that expectation. And I was talking to a anaesthetist a couple of months ago, and he said it's really hard for him to manage patients post-op because everything is just so patient driven here in the US. And if he gets bad patient scores from his patients coming out of surgery, then he'll get reprimanded. And so it's hard because you're going to go into surgery and you need to have the expectation that it is going to be some discomfort and some pain post operation. And so if you don't have, you know, if you don't have patients coming in expecting to feel some discomfort at times, and that it's going to be hard, you're going to be pushed in physical therapy. There's going to be days post-op where you don't want to get out of bed, and somebody's going to come along with a walker and make you stand up. And if you don't do that, then your chances of post-operative complications, etc., just skyrocket, as we know. If a patient doesn't want to get out of bed and says they're going to fall if they stand up, they'll just stay in bed. Whereas I feel like in Australia, I feel like we've got more capacity to help push patients to get them the best results as well. So I think that's the difference. Phenomenal healthcare, just sometimes the systems, work, more favorably, I guess, in Australia, I would say.
Thank you so much. That's a really interesting takeaway for our listeners who might not be familiar with, the way that healthcare systems work in both countries. And given your unique experience, I think that's really
Yeah.
important to get your
Yeah.
feedback on that. Is there any other final thoughts you had before we wrap up here about delivering great patient experience and what you've learned over the years?
No, not really. Just, thinking about all the time that you are there for a patient advocate, right? You're there to be that person if they don't understand what's going on, that you need to take the time to explain things to them and help them feel like they're have the or that they've taken a little bit of control back. I feel a lot of the times when patients, are short with nurses or physicians, it's from the fact that, they're scared, they don't understand. So the more time we can spend empowering patients and being their advocate, it's going to get better results for the patients and, make our lives easier as healthcare professionals.
This has been a great discussion, Carly. Thank you so much for your time today. I'm extremely excited to get this one out to our listeners.
Thank you so much, Casey. Thanks for having me.